Hello, good day everyone. I am Guadalquiver from BSN 11G, Group 27. And so for today, I'm going to perform a proper routine demonstration about the assessment of cardiovascular system. So cardiovascular system is an organ system that permits blood to circulate and transport nutrients, oxygen, carbon dioxide, and hormones and blood cells to and from the cell of the body, and it provides nourishment, fight disease, and stabilize temperature and maintain homeostasis. So first and foremost is we need to check for the patient's medical record if any. Next is we need to determine the scope of the assessment and prepare the equipment to be needed. So we have the stethoscope, we also have the centimeter ruler, we also have the pen light, the surgical gloves, also we have the comprehensive assessment form and alcohol. And next, perform hand hygiene in order to deter the spread of the microorganisms, and don gloves if necessary. So I already closed the door, fixed the curtains, adjust the room temperature, and provide adequate lighting for my patient's comfort and privacy. So hello, good day sir. How are you feeling today? Okay, so it is important to greet the client in order to establish a good rapport between the healthcare provider and the patient. So sir, let me introduce myself to you. I am Guadalquiver and I am your student nurse for today. So may I know your full name please? Okay, so when is your birthday? Okay, so how would you like me to call you? Okay, so which language do you prefer? Do you prefer English or Bisaya? Okay, Sir Ben, thank you. So Sir Ben, the procedure that I'll be doing is I'm going to assess for your cardiovascular system or your heart. So this is to determine whether there are any abnormalities in your heart. And there are certain procedures that you need to follow, and I am going to touch some parts of your body. So is that okay with you? Any concerns or any questions? Okay, thank you. So it is important to explain the procedure of the assessment to the patient so that they will know how can we participate on the assessment. So Sir Ben, I'm going to ask some questions. Is that okay with you? Okay. So sir, do you feel any chest pain? Okay, so do you have a past health history such as myocardial infection? So how about your lifestyle habits? Is it okay? Okay, thank you. So first is we need to assess for the jugular veins. Stood at the right side of the client and position the client into the supine with the head of the bed elevated between 30 to 45 degrees, making sure that the head and torso are on the same plane. Instruct the client to turn the head slightly to left and show tangential light source onto the neck, supranasal notch, and area around the clavicle to observe for pulsations and shadows. So sir, I'm going to show light on you. Is that okay with you? Okay. Can you turn your head? Okay, thank you. If jugular distension was noted, assess the jugular venous pressure or the JVP by locating the highest visible point of distension of the internal jugular vein. Emphasize the distension with the tangential lightning. As deemed necessary, raise or lower the head of the bed to 30, 45, 60, and 90 degrees until the highest visible point of distension of the internal jugular vein was observed. Measure the vertical distance in centimeters above the sternal angle by exceeding a long rectangular object or card horizontally from this point of centimeter ruler vertically from the sternal angle, making an exact right angle. I'm going to measure C. Can you turn your head? Okay. And next is we need to assess for the carotid artery. With the head of the bed still elevated at 30 degrees, position the client's head slightly toward the side being examined. Palpate the carotid artery cautiously, avoiding too much pressure or massaging the area. Repeat the proceeding on the other side. So can you turn your head? Can you turn your head, sir, for me, please? Okay, thank you. So turn the client's head slightly away from the side being examined. Place the bell of the stethoscope over the carotid artery and ask the client to hold his or her breath for a minute and auscultate for the carotid artery, listening for bruit. If a bruit was heard, gently palpate the artery to determine the presence of a trill. So repeat the preceding step on the other side. So Sir Bien, kindly inhale for me, please. And hold for it. Exhale. On the other side, kindly inhale for me and hold it for me, please. Exhale. So now we are going for the inspection and palpation. Begin with general inspection of the chest wall. In women, keep the right chest draped. Gently lift the breast with the left hand or ask the women to do this for assistance. Stood at the right side of the client with the head of the bed elevated at 30 degrees and look for any abnormal pulsation. Shone a tangential light across the chest wall over the cardiac apex to make this movement more visible. So, okay, sir. I will inspect your chest wall. And I'm going to shine a light. Is that okay with you? Simultaneously, inspect for the pericardium for position while palpating the aortic area, pulmonic area, tricuspid area, and apical area following the techniques below. Palpate for the head heaves the lips using the palm or hold the finger pads flat or obliquely against the chest. So I'm going to palpate your chest wall. Okay. For trills, press the ball of the hand firmly on the chest to check for a buzzing or vibratory sensation caused by an underlying turbulent flow.
So now we'll proceed with our self-assessment of testicular self-examination. So means your testicular self-examination should be
Okay, thank you. And palpate impulses using the finger pads slightly obliquely on the body surface from the aortic area and pulmonary area and tricuspid in the RV in the right ventricular area on the lower left sternal border and the subxiphoid area using the palmar surface of the hand. Palpate the umbilical impulses using the palmar surface of 2 to 3 middle fingers. Then for finer assessment, palpate with one finger alone to confirm the characteristics of the apical impulses using noting for the location, diameter, and amplitude.
index and middle finger reverse under the testes of the thumb and palm. So dalawa din yun yung pictures na pinit on a picture. Roll the testes gently
And use one finger in order to confirm the characteristics of the apical impulses. So, If unable to palpate the apical impulses with the patient's supine, reposition to the patient to roll partly onto the left lateral side and palpate again using the palmar surface of several fingers. If still unable to palpate, ask the patient to exhale fully and stop breathing for a few seconds and palpate again while the patient maintains to be partly facing his left side. So sir, kindly move to the side for me please. Okay sir. And kindly hold your breath for me please. Inhale. Exhale. Okay. You can, okay. So inspect and palpate for the epigastric area on the base of the sternum and abdominal aortic pulsations.
So that's it for your subjective data. Now we will proceed with
So now we are going to assess for the auscultation. Assess for the heart rate rhythm by placing the diaphragm of the stethoscope at the apex and listening closely to the rate and rhythm of the apical impulse. Counted the heartbeat for a using full minute if an irregular rhythm was detected. Assess for a post-rate deficit. Use the diaphragm of the stethoscope first, then the bell. Auscultate in the heart in all four anatomic sites, which is the aortic, pulmonic, tricuspid, and apical or mitral for heart sounds, extra heart sounds, and murmurs. Ask the client to breathe regularly while auscultating. And repeat the preceding steps while the patient is in left lateral position, then at sitting position, leaning forward to briefly stop and after exhalation. So sir, kindly inhale for me please. Exhale. Inhale, exhale, inhale, exhale, inhale, exhale. Can you to the side for me, please? Thank you. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Kindly do a sitting position for me, sir, please. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Okay, thank you sir. You can lay in your bed now. So now we are going to examine for the upper extremities. Assess for each size, symmetry, skin color, and temperature from fingertips to the shoulders. Noted for any presence of edema, lesions, changes in skin texture, and hair distribution. Okay, sir. I'm inspecting your upper extremities and checking for the temperature and to the other. So I see that your hair is evenly distributed and your skin is intact. And your skin temperature is warm. Okay. So inspect for the peripheral veins of the arms in the presence or appearance of superficial veins when limbs are dependent and when the limbs are elevated. Okay, so I'm inspecting for your peripheral veins. So now, palpate for the radial pulse, ulnar pulse, and brachial pulse individually and bilaterally. So now I'm going to palpate for your So now I'm going to palpate for your ulnar pulse. And now for your brachial pulse. Okay, thank you, sir. So, assess for capillary refill. So now, perform the Allen's test. So please, sir, kindly pump your hand for me, please. Keep pump. Keep pump. And can you close it? Open. Okay, pump again. Stop. Open. Okay, onto the other hand. Kindly pump your hand for me, please. Okay, stop. Open. Okay, pump again. Stop. Open. Okay, thank you. And repeat the preceding steps on the other arm. So now I'm going to examining the lower extremities. At supine position, assess each leg for the size, symmetry, skin color, and temperature from groin to toes. Noted for any presence of lesion, changes in skin texture, and hair distribution. So sir, I'm going to inspect for your lower extremities. So okay, I see that your hair is evenly distributed, your skin is intact, and it is warm to touch. And also to the same leg, skin is intact, warm to touch, and consistent all over. Okay, thank you. So now, I'm going to inspect for the peripheral veins in the legs for the presence or any appearance of the superficial veins when limbs are dependent and when limbs are elevated. So, okay, sir. I'm going to inspect for your any peripheral veins. Okay, to the other leg, please. Okay, thank you. So, assess for the peripheral leg veins for ulceration, varicosities, and thrombophlebosis. Inspect for the calves for ulceration, varicose, and redness and swelling over the veins. And palpate the calves for firmness and tension of the muscles and presence of the edema over the dorsum of the foot and area of the localized warmth. Push the calves from side to side to test for tenderness. So inspecting for any ulcerations, varicose, and thrombophlebosis. Okay. And firmly dorsiflex the client's foot while supporting the entire leg in extension, and do Homan's test or had the client to stand or walk. So, okay, sir. I'm going to do a Homan's test. And to the other leg. And assess for the capillary refill of both legs and repeated the preceding steps with the other leg. So, okay sir, kindly stand and kindly sit or walk for me please. Kindly walk for me please. Okay, walk. Okay sir, thank you. You can now go back. You can now go back and okay sir. And I'm going to assess for your capillary refill. Okay. So, inform the client assessment was done. If deemed necessary, assist the client to change clothes, reposition the client into a comfortably sitting on a chair. So, okay, sir, we are done with the cardiovascular assessment, and I'm going to summarize all the information that I've gathered. Rest assured that all the information that I've gathered is confidential and proceeded to the doctor directly. So, okay, sirs, for your jugular veins are normal because the veins is not visible, indicating that the right side of your heart is functioning normally, which is good. So, in assessing your carotid artery, it has a symmetrical volume, full position, interesting quality. It remains the same when you breathe. So, when you turn your head, when you change position basically to supply a no sounds heard, or auscultating your carotid arteries. While inspecting and palpating for your aortic or pulmonary and tricuspid area, there are no pulsation, no lifts or highs. In the apical area, pulsations are visible and palpatable. In most, no lift or highs. In epigastric area, it is normal because of the aortic pulsations. Your systole is shorter and your diastole is long and it's a normal heart rate. And of course, S3 is heard because you are an adult, which is good and normal. So in the findings in examining your upper extremities is that your ulnar pulse is not detectable and your brachial has equal strength bilaterally. Your radial pulse is bilaterally strong. Artery has a resilient quality. In capillary refill, it immediately returned to its normal color. Then the Allen's test, it launches directly. So in your lower extremities, your skin is pink. The temperature is not excessively warmer, cold, so no edema. Skin texture is resilient and no moist. So independent position, there are presence of distension and nodular bulges. Your legs are elevated and your veins collapse. Your symmetric pulse volume is here, and for the full position, it is symmetric in size. Limbs for your capillary refill, the color returns immediately, which is good and normal. So overall, your findings is good and normal. So summarize the information obtained during the working phase and discuss findings with the client. Discuss the client possible to remove health concern if present. Assess the client understanding to plan and need for further teaching to provide the client opportunity to clarify and ask or raise any questions. So Sir Bien, I suggest you to make vegetables and fruits as a centerpiece of your diet. Eating a variety of fruits and vegetables every day is great for your cardiovascular health, and they are rich in vitamins A, C, and E. Also, eat poultry and fish because this has less cholesterol, which is low risk of having a heart disease. Also, reduce or eliminate high fat, high calorie, or low nutrient food because these are high risk of having heart diseases. And also manage your sodium intake to reduce of risk in having high blood pressure. So, okay, thank the client for his cooperation and ended the assessment politely, done after care and perform hand hygiene, and document the findings on the client record using the printed or electronic forms of checklist supplemented by narrative notes when appropriate. So, okay, sir, thank you for your time and cooperation. Have a nice day. And so that's it for the return demonstration about the assessing of the cardiovascular system.